Dumping syndrome is most commonly associated with which medical condition? A. Type 2 diabetes. B. Gastric ulcers. C. Gastrectomy. D. Inflammatory bowel disease. And the correct answer is C. Gastrectomy. Dumping syndrome is often related to gastric surgery, particularly procedures like gastrectomy. These surgeries alter the normal anatomy of the stomach, leading to a rapid emptying of stomach contents into the small intestine. Symptoms of dumping syndrome include abdominal cramps, nausea, diarrhea, sweating, weakness, and dizziness. This condition is more commonly observed in individuals who have undergone specific types of gastric surgeries. Severe generalized edema is also called as A. Cachexia, B. Anasarca, C. Ascites, D. Lymphedema. And the correct answer is B. Anasarca. Severe generalized edema is commonly referred to as anasarca. Anasarca is a medical term used to describe the extensive and widespread swelling or edema that affects multiple tissues throughout the body. This results in accumulation of fluid in the interstitial spaces. This condition can be associated with various underlying medical issues such as heart failure, liver disease, or severe malnutrition. Options A, C and D represents different conditions or forms of edema, but they do not specifically denote severe generalized edema. Which of the following is not a plasma-derived chemical mediator? A. Cytokines, B. Complement components, C. Kinins, D. Coagulation proteins. And the correct answer is A. Cytokines. Cytokines are not plasma-derived chemical derivatives. They are signaling proteins produced by cells. Which of the following increases vascular permeability during acute inflammation? A. Histamines, B. Cytokines, C. AFP, D. Both A and B. And the correct answer is D. Both A and B. Both histamines and cytokines play crucial roles in increasing vascular permeability during acute inflammation. What is the underlying mechanism behind the characteristic feature of acute inflammation? A. Increased appetite, B. Pancytopenia, C. Vasodilation and increased vascular permeability, D. Spongy bone marrow. And the correct answer is C. Vasodilation and increased vascular permeability. Vasodilation means that the blood vessels expand or get wider. When you get hurt, your body wants to send more blood to the injured area to help it heal. So the blood vessels open up, allowing more blood to flow. This increased blood flow makes the area look red and feel warm. On the other hand, increased vascular permeability means that the walls of the blood vessels become a bit leaky. Imagine the blood vessels as pipes, and they allow some fluid, proteins and cells to move from the blood into the tissues around the injury. This is helpful for the healing process, but it also causes swelling and can make the area hurt. The classical substances that increase the sensitivity of pain receptors by enhancing the pain-provoking effect of bradykinin is A. Nociceptor, B. Endorphins, C. Prostaglandins, D. Encephalin. And the correct answer is C. Prostaglandins. Bradykinin is a peptide that contributes to inflammation and pain by sensitizing nerve endings. Prostaglandins, when present, can amplify this effect, making the pain receptors more responsive to bradykinin and other pain-inducing signals. What natural chemicals are released in response to stress or physical activity, acting as natural painkillers and contributing to a sense of well-being? A. Insulin. B. Endorphins. C. Serotonin. D. Cortisol. And the correct answer is B. Endorphins. Endorphins are the natural chemicals produced by the body primarily in response to stress or physical activity. They function as natural painkillers, inhibiting the transmission of pain signals in the nervous system. Endorphins also contribute to an improved mood and a sense of well-being, making them often referred to as feel-good chemicals. An opening of surgical wound edges is called A. Wound evisceration, B. Wound rupture, C. Wound approximation, D. Wound dehiscence. And the correct answer is D. Wound dehiscence. Wound dehiscence is a medical term that refers to the partial or complete separation of the layers of a surgical incision or wound that was previously closed. This condition can occur after a surgical procedure, trauma, or any form of wound closure. Wound dehiscence is a serious complication that can lead to various consequences, including infection, delayed healing, and impaired cosmetic outcomes. Which of the following types of exudates contains fibrin? A. Hemorrhagic exudate, B. Serous exudate, C. Fibrinous exudate, D. Purulent exudate. And the correct answer is C. Fibrinous exudate. Fibrinous exudate is characterized by the presence of fibrin, a fibrous protein that plays a crucial role in blood clotting and wound healing. Hemorrhage with the collection of blood in the soft tissue is called A. Contusion, B. Purpura, C. Ecchymosis, D. Hematoma. And the correct answer is D. Hematoma. A hematoma is a bad bruise. It happens when an injury causes blood to collect and pool under the skin. It is a collection of blood outside of a blood vessel. All of the following are evidences of an infection except A. Elevated WBC, B. Purulent drainage, C. Primary intention, D. Increased leukocytes. And the correct answer is drop your answers in the comment section below. For downloading PDF content and for latest updates, follow our Telegram channel. I have given the link in the description below. If you like this video, don't forget to hit that like button. Thanks for watching.